In this video, I'm going to provide some tips on how to set up your facelift recovery station so that you have all the things you need close at hand in the first few days after your surgery. Many patients find they feel more organized and less anxious about their surgery if they are well prepared. The vast majority of facelift patients are able to move around their home or hotel room easily in the first day or so after their surgery. Remember, you are encouraged during the first week to rest but not bed rest. You'll feel better if you move around and get out of bed. So while you will spend some time relaxing in your bedroom or living room, you certainly aren't going to feel bedridden. But in terms of how you will feel emotionally, you'll be more relaxed and less anxious if you prepare in advance and have your essentials close at hand near your recovery station. Fill your prescriptions about a week before your surgery and have them on hand. You'll need to take a dose after you return from the surgery center following your procedure, so make sure your caretaker has access to your pre- and post-operative instructions and your prescription guides so that they can help you take the appropriate dose. Make sure you read the information on our website about your medications. Some, like your antibiotic, are mandatory. Others, like your pain medication, are optional. We prescribe them for you in the event you need pain management, but they do have side effects such as drowsiness. Should you not need them, that's great and you'll feel better without them. Let's talk about fluids. You'll feel better if you keep hydrated and sleep better if you avoid caffeine and sugar. So for your shopping list, make sure you stock up on bottled water or other beverages. Keep them cool in the fridge if possible, just because it'll feel good to have a nice cold drink, and plan to drink 8 to 10 glasses per day. Many patients can eat normally right after their surgery, while others find that their mouths feel a little tight and a little sore. So having healthy, easy to grab soft foods is a good idea. Meal replacement or health bars are ideal since they're easy to grab, easy to eat, and provide the nutrients you need. Another nutrition option to consider are smoothies. Our patients love them. You'll want to make sure that you have either ready-to-go mixes that just require that you add water and shake, or that you pre-purchase the ingredients you need to make them on your own. Fill them full of fresh fruits and vegetables and enjoy. You should be feeling well enough to make your own smoothies, and it's recommended that you get up and do so. There are some simple things you can do after your surgery to help you feel more comfortable. What will help the most is sleeping in a reclined position. This is by far the best way to manage swelling, which is the #1 cause of post-surgery discomfort. Please follow your pre- and post-operative instructions and sleep with your head elevated. We'll talk more about that in a minute. Aside from this, keeping cool will help, but Dr. Buonassisi does not want you to apply ice directly to your face. Make sure you check out our other video which explains why. Instead of applying ice, you can soak clean cloths in ice water and use them on your forehead, cheeks, and chest area to cool down. Keep in mind the objective is to be cool and not ice. Another simple thing to consider is having a nice scent. Visit your aromatherapy store before your procedure and ask for something that will lift your mood after surgery. A soft, mild scent can do wonders for your general sense of well-being. Sleeping and resting in a reclined rather than flat position will help considerably with swelling, and fortunately, it can be uncomfortable to sleep this way. Here are some things that you can do to make reclined sleeping easier. Make sure you have lots of pillows around. You'll need to prop up your arms and your head. Keep your head elevated at approximately 30 to 40 degrees. You have the option to purchase a bed recliner. They're not essential, but some patients have found that they're a little more comfortable than sleeping with pillows in their bed. And keep in mind that sometimes the couch is better. Some patients have told us that it's easier to get propped up on their couch than it is in their bed. The last thing to consider doing is trying out some sleep options before surgery. Test out your pillows, your bed, and your couch and see what works the best. The last thing I'd like to say about reclined sleeping is that you don't need to over-engineer it and you don't need to worry about it too much. If you roll off your pillows in the middle of the night and end up sleeping flat or on your face, it's not the end of the world. Just try again next time you plan to sleep. It is important that you follow your pre- and post-operative instructions when it comes to incision care, so you'll need to buy these items in advance and have them handy for your recovery. Q-tips are used to apply polysporin. Make sure the polysporin you purchase is the ointment type and not the cream type. A handheld mirror can make it easier to apply polysporin to the incisions behind your ears where they are hard to see. Medical gauze is used to protect your staples from your compression garment and also to tidy up when necessary. Tidying up after your facelift will feel really good. You'll be able to shower after your bandages are removed at your one-day post-op visit. Please watch our video called How to Shower After Your Facelift to learn more about how to do this. The supplies to have on hand for tidying up include a clean wash towel, gentle fragrance-free shampoo like a baby shampoo, and of course your toothbrush and toothpaste. Your mouth might be a little sore in the first couple days after your surgery, so have some mouthwash on hand in case this is a little easier. Your compression garment has a dual purpose. It helps with swelling and healing, but it also acts as part of your disguise. Be sure to see our other videos called Disguising Yourself After Facelift Surgery and How to Use Your Compression Garment for more information. Please follow your pre- and post-operative instructions and wear your compression garment as much as possible for the first couple of weeks after your procedure. Be sure to have sunglasses, a beautiful scarf, and a nice hat on hand. You will be feeling fine enough to get outside, and we recommend you do so. You may be surprised how liberating a good disguise can be. Have a plan for entertaining yourself with your cell phone, books, and movies ready to go. The time will pass more quickly if you're entertained while you relax and recover. Tools for moral support. There may be times, especially during the first week, when you aren't looking your best, when you will feel down or discouraged. It's important that you remind yourself that this too shall pass, and how you look now is no indication of how fantastic you will look when your recovery is complete. It's a good idea to have on hand these tools for moral support. A computer, so you have access to the many resources we have on our website, 8west.ca. These are designed to support you and help you cope so you know what to expect in the first weeks after your procedure. A journal. Many patients find it helpful and therapeutic to document how they are feeling in a journal. A camera, to take regular photos of your progress. Seeing how you look on day 3 compared to how much better you look on day 10 will be a great help and mood booster. Be sure to call our office anytime if you have questions or you simply need some reassurance that what you are experiencing is normal. Your pre- and post-operative instructions. All of the essentials of your recovery are summarized in your pre- and post-operative instructions. Please keep a digital or paper version on hand. Review them in advance with your caretaker so they too know what to expect. Please visit our website, 8west.ca, for more resources and information that will help you prepare and recover from your facelift.